Here we're going to look at the bleeding disorders. So we're going to compare the bleeding disorders with versus the coagulation disorders. Coagulation disorders. So before we start, we are going to always start with the questions. First question is, describe the superficial ecchymosis in these two conditions. The second question will be, describe the heme arthrosis in these two conditions. So we'll find out these answers and learn in detail. So firstly, we are going to look at the characteristics, the headings, and then the features among the both, the cause. So wherever I'm going to describe the first will obviously be the bleeding disorder, and then we are going to look at the coagulation disorders. So first we are looking at the cause. The cause will be there is the quantitative as well as the qualitative. The quantitative and the qualitative platelet abnormality. This is in case of the bleeding disorder. Next, in case of coagulation disorder, it is basically the deficiency of the clotting factors. The deficiency of the clotting factors. Then what about the sex? So in bleeding disorders, it is more common. It is highly increased in case of the females, and it is mostly associated with the autoimmune conditions. Whereas in case of the coagulation disorders, it is most commonly present in the males, and it is commonly X-linked. Next, we will look at here we have bleeding disorder, and the other hand we have the coagulation disorder. So now we are going to look at the family history. So what about the FH, family history? So family history, it is very rare in case of the bleeding disorder. It's rare means except the VWD, that is a von Willebrand disease, it is very rare. And what about the coagulation disorders? Coagulation disorders, it becomes very common. The family history. And after the family history, we look at the pedicare. So the pedicare is very characteristic. It is characteristic in case of the bleeding disorder, whereas in case of coagulation disorder, it remains rare. So what about the superficial ecchymosis? So superficial ecchymosis, it is small. If you see, in case of bleeding disorder, it is small as well as the multiple. It is small and multiple, whereas in case of coagulation disorders, the superficial ecchymosis, it is large. It is large as well as it is solitary. Then we move on to the bleeding and the superficial cuts. So what happens in case of bleed or the superficial cuts? So in terms of the bleed, it is profuse in case of the bleeding disorders, and in case of the coagulation disorders, it is minimal. Then we move on to the hemarthrosis. So hemarthrosis, it is rare. In the bleeding disorders, it is very rare. Whereas in case of the CD, that is a coagulation defects, it is very characteristics. It is characteristics that is most common, is present in the knee. Then we have the deep dissecting hemarthrosis. The deep dissecting hematomas. Deep dissecting hematomas. So in case of the bleeding disorder, it becomes very rare, and here it is characteristics. So characteristic where it is very characteristic in case of the coagulation disorders, and it is most common in the iliopsoas. Next we move on to the lab test. So what happens in the lab test? So in case of the lab test, the BT, the bleeding time is prolonged. Okay, the bleeding time is prolonged. Whereas in case of the lab test here in coagulation disorders, the PT or the PTT is prolonged. It is prolonged. Then we move on to the most common bleeding disorder. This is nothing but the von Willebrand's disease. And what about the coagulation disorders? Coagulation disorders, it includes the herited. So under the herited coagulation disorders, it includes the hemophilia A. The hemophilia A. Then we also look at the acquired. So under acquired, it includes the hemorrhagic diathesis. The hemorrhagic. It includes the hemorrhagic diathesis, and this is nothing but of the liver disease. So now to just go back to answering our questions. So the first question we asked was, comment on the superficial ecchymosis. So this was the question we asked. So superficial ecchymosis, what we need to know is the bleeding disorder. So what is the bleeding disorder? In case of the bleeding disorder, the superficial ecchymosis is small. It is small and it is multiple. Okay, it is small and it is multiple. Then we look at the coagulation disorders. How is it in the coagulation? Coagulation. So in terms of the coagulation disorder, it is very large. It is large. Coagulation disorders is large. And it is solitary. It is large and solitary. It is large and solitary. Large plus solitary. So the next question we asked was, what is the hematomos? What is the hemarthrosis? Comment on the hemarthrosis. So in case of the hemarthrosis, we look at the bleeding disorders, BD. So under bleeding disorders, the hemarthrosis is very rare. Okay. And the second thing to note is the hemarthrosis in case of the coagulation disorders. In terms of the coagulation disorders, it is characteristic. We need to know it is characteristic. And where is it present? It is present in the knee.